start with THC. So THC is the neuroactive constituent of the cannabis plant. It is responsible for that euphoric feeling known as being high. It was discovered by Dr. Raphael Mechoulam in 1964, and there is his portrait. THC is used to aid or alleviate the symptoms of various ailments such as pain, muscle spasticity, glaucoma, insomnia, low appetite, nausea, anxiety, and more. THC alleviates these ailments by mimicking our endocannabinoids and using those receptors to induce its effects. THC can cause temporary side effects, those such as anxiety. This side effect can be mediated by taking THC at lower doses or in combination with other cannabinoids such as CBD. Also good to take it in whole plants or full spectrum formulations. And CBD. CBD is non-psychogenic, thus its effects are generally not felt. Having said that, usually in high doses, it can exhibit relaxing or sedating effects by its interaction with neurotransmitters. CBD has been shown to be useful at treating the symptoms of various conditions, such as seizures, inflammation, pain, some mental disorders, IBS, nausea, migraines, depression, anxiety, and more. CBD is useful in combination with THC as it can reduce impairing effects, but also several studies have shown that CBD is more effective with the presence of THC. So even if just found in fractions of a percentage, THC increases the efficacy of CBD. Now, it is impossible to talk about CBD and not mention Charlotte Figi. Charlotte Figi was a little girl who was diagnosed with a rare form of epilepsy that began in infancy. Her parents turned to medical cannabis as a last resort to help their daughter, and CBD had a huge impact in her care and quality of life. If not for Charlotte and the efforts of her family, millions of people around the world who suffer from epilepsy might not have access to CBD today. She was instrumental to the medical cannabis movement.